Hello and welcome back to week 3 of class. This is Health Communication and I'm Bram Duffee, your instructor. Today we're going to be looking at the third chapter, which is going to be about caregiver privileges and how these challenges that lay caregivers go through really affect everything in the process and of taking care of a patient and helping a patient. And so when we talk about lay caregivers, these are people who provide care to someone who has a health issue but doesn't really have formal training. So these are people like family members, friends, or neighbors. And while their role is really critical for a lot of folks, it also comes with some pretty crazy challenges. I think it's important to understand that these lay caregivers, well, they often experience similar levels of suffering and loss, just like the patients that they're taking care of. And so if I think about cases like, well, maybe a daughter who's caring for her mother with Alzheimer's disease, not only does she have to cope with the physical demands of caregiving, but she also experiences like emotional distress and witnesses her mother's declining cognitive functions and stuff. And so the daughter might feel a sense of loss, a loss for the relationship that they had, or a loss of shared memories, and even a loss of her own personal time and freedom. The social support that a patient gets can really impact them in several ways. There are emotional comforts that can come, and also, of course, practical assistance, and then valuable information. That all comes with the ways that social support systems can help someone. So, for example, a cancer patient might receive emotional support from a support group, and then they get practical assistance in the form of meals or rides to appointments from friends. And they might get information about treatment options from family members who have done research. It's just this multifaceted support can alleviate stress on some people and improve their mental health, and also enhance the patient's ability to manage their lives. And all of this can, in the right circumstance, lead to a better overall health outcome. There are also some indirect impacts that happen when we look at social support influencing someone's health. So, for instance, supportive relationships can encourage healthy behaviors. If a person is surrounded by friends who exercise regularly and eat healthy and abstain from smoking, then they're likely to adopt these same behaviors themselves. Similarly, social support can buffer against stress. So when faced with a health crisis, the emotional and practical support from others can help people cope better. And this reduces harmful effects of stress on the body. So if someone's dealing with a chronic illness, they might feel less anxious about their condition if they have a support system or a network that they can lean on for comfort or assistance. So all of this was like a fancy way of saying that having the right people around a patient, having the right family around, and with caring, concern, and wanting to help, all of those things can be really positive for a patient and really helpful. But I have seen, and others may attest to, the fact that this kind of stuff can also be a double-edged sword. So while a family member might be really awesome at providing support, their involvement is not always beneficial. And when I think about why that would be the case, sometimes family dynamics can just be complex. And in some situations, the family involvement can lead to increased stress or conflict. So I think about the young adult who has diabetes and they feel overburdened by their parents' constant monitoring of their diet and insulin levels. And in this case, well, the support from the family, well, it's like well-intentioned. It might feel more like control or someone's trying to push onto them. And all of these feelings lead to the tension, and that tension can undermine the self-management efforts that the family wanted to have happen. So when you give really overwhelming concern to someone, it can be a turnoff in different ways because of the experiences they've had or because of the independence that they are trying to show. When we consider health communication, we have to acknowledge that there's a significant role that caregivers have and a significant role that social support can give. But we also have to bear in mind that these elements are sort of nuanced, and it can vary depending on the circumstances. So as we continue exploring how communication works out in health throughout this course, I want you to be able to keep these complexities in mind and apply them to your understanding of health communication. Just to share my own experience and easy examples, I think about the difference that happens when I take a hospice patient home. And I've had some cases where the family is there, waiting for the patient and have done things to prepare the environment for them and has communicated with a hospice agency ready to receive the patient. I've been in lots of those situations. And then I've also been in lots of situations where there's no one to take care of the patient but themselves. And the folks that might be the reach out people are folks like neighbors or someone who's not close at all. And these are sad situations. And unfortunately, we have to know that the family support and social support can push both ways in undermining instances. If we think about social support, one of the things that's happening right now is a big talk about monkeypox. And it's a good example because it's a conversation that folks have based on watching videos and understanding. But at the same time, it is so overwhelming to see someone, with those monkeypox on their face, that it's a turnoff and scares folks. So they might not understand that it is a virus that anyone can get. And it seems like that even just close communication are ways of concern. And so it's knowing that your body would need to understand what it is so that it could fight it. And so there are many different instances where someone might be in a risk pool where they need something, but they are communicated that message in a wrong way. And these things can happen so both positive and negative ways through communicating with and through these social support systems and methods. So good time with our current week. I look forward to seeing you in the discussion board, and we are off to a great start in week 3. Thanks for listening.